Did you know uterine shape is determined before birth? I'm sure my guest, Dr. Serena H. Chen, reproductive endocrinologist from IRMS at St Barnabas in New Jersey, knew that. Serena,
Yeah.
thanks for joining me.
Happens in 3 out of every 100 people or women.
So not very rare.
Yeah, no, not very rare. But like most of the time doesn't have any symptoms. So people don't know they might be walking around with an abnormally shaped uterus until maybe they try to get pregnant, or sometimes not even until they actually have the baby, they find out.
Which is nuts. So when we talk about the uterus and abnormalities, we could be talking about size, we could be talking about structure, even the shape itself. What are some common terms that we need to know, though? Because as I understand it from our pre-conversation, there's a lot of confusion around the diagnostics itself.
Yeah, so the number one uterine abnormality or Mullerian abnormality, they call them Mullerian abnormalities because the Mullerian tubes are the structure that the uterus is made from in the fetus. The number one abnormality is the uterine septum or a septate uterus. So that's a uterus that has like a dividing wall down the middle. And but
literally a wall, almost like there's two uteruses,
like a fibrous wall,
like a fibrous wall. Okay, interesting.
Right down the middle.
Okay.
And but the most common term that's used when people get like a pelvic sonogram or a pelvic MRI is actually a bicornuate uterus. And bicornuate, you know, that means the radiologist is seeing like 2 cavities, but in reality, bicornuate means not just 2 cavities, but 2 horns on the outside of the uterus. So if we do this, the most common uterus is a septate uterus. I don't know if you can you see that?
Yeah, it looks like a heart.
Yes, but you see how it's flat on the top?
Yes.
That's the outside of the uterus. The heart part is the inside of the uterus. So that's a septate uterus because this wall divides the uterine cavity, but the outside of the uterus looks normal. It's got a flat top. Okay.
So with an ultrasound, you would look at that and think that it's normal, right?
Right. And then, but you might be able to see, the heart shape inside, because depending on the part of your cycle you're in and the quality of your scan, you could see. Now this is the inside is heart shaped.
Okay.
You know, and then the outside is also heart shaped.
Okay.
So that means you have those 2 horns. So
Got
that's
it.
like having 2 uteruses. This is
I see.
bicornuate because the outside is 2.
And the outside is 2. Got it.
Whereas a septate, the outside is single and the inside is 2.
Do you need an HSG to be able to see the inside versus just a regular vaginal ultrasound?
Like sometimes you can see it on sonogram. Saline sonogram can be helpful. HSG can be helpful, but HSG, the septate and the bicornuate look exactly the same on HSG.
Because the inside is still a heart. Yeah. And so you have tubes. If your tubes are open, they're opening to each side of that heart.
Right.
Which still can prevent pregnancy from developing normally.
We do not do surgery on this.
Okay. So don't do surgery on bicornuate.
It just has to be watched carefully.
Got it.
So your OB should just keep a careful eye on you, watch you closely. You might need to rest at the end of the pregnancy, and you know, maybe the baby's going to be breech because
there's a lot of room to move around, right? Yeah. I mean, you're basically dealing with like half the amount of space.
But most of the time, people with a bicornuate uterus with a little extra TLC will do fine. This is very, very simple to repair. It's a very minor surgery.
Wow.
Just outpatient surgery. You just go in through the vagina. So there's no real incisions. You just go in through the vagina and go snip, 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 and you get rid of that.
So micro snipping the fibrous so that then there's no more heart and it's sort of like the inside just takes the right shape.
It doesn't even bleed because it's just fibers.
Wow.
It's not really, it's like leftover. That's the last piece. Because
Okay.
when we're little fetuses, we all have two uteruses. We've got two, like kind of like a dog or a rat or, a cow.
We do. When we're fetuses, as girls, we have two uteruses when we start.
Right. And then it merges together, and that septum part is the last part to get absorbed. So we end up with just one cavity.
How fascinating. Okay,
Yeah.
I love this. I'm learning so much. I'm learning so many new things. Okay, now what I'd like to understand too is if you have the actual bicornuate uterus and you do have a pregnancy, but you still have that fibrous wall down the middle, correct?
It's not really fibrous in a bicornuate. It's muscular. So the implantation is not really impacted the same way as it is with a septate uterus. So you could still get plenty of blood flow. It's like two full separate uteruses.
Wow. Okay. So does one grow during the pregnancy? I remember them telling me your uterus is supposed to grow 400 times the size during pregnancy, then one side doesn't grow at all?
Doesn't grow as much.
As much. Okay. It still kind of grows. Okay. Yeah. This is fascinating. All right. So to kind of recap that, you wouldn't do surgery on the bicornuated uterus. You would only do surgery on the, how did you say it again? Because it sounded like septate.
But
yes.
You have to remember that radiologists will often call both of these things bicornuate.
Which is the confusion.
Yeah, that seems to be a very common term used by radiologists, even though as reproductive specialists, we need to differentiate between septate and bicornuate because it's very different approach, very different prognosis.
Sure.
Plan. And septate uterus is like 10 times more common than bicornuate. So if you're told you have a bicornuate uterus, 9 times out of 10, you might actually have a septate uterus. So it's very important to see a specialist who really understands and treats these things and, can look at you inside and out, not just a picture on a radiologic scan.
Here's a crazy question. Would a septate uterus increase your risk of a tubal pregnancy because it kind of gets in there and hits?
You would think it would, but it doesn't seem, we don't really see that statistically. It does seem to increase miscarriage.
Okay, got it.
But it does not really seem to increase the risk for tubal.
And that is that assumed because the blood flow is constricted because of that fibrous wall?
That's kind of what we think.
Okay, got it. So a lot of unknowns, which is why it's just better to get the surgery done. If you've got open tubes, you don't need IVF, but you still need a specialist who is great at doing kind of the microsurgeries. And there's no risk of scar tissue then impacting the ability for, implantation.
With the septum, you do have to take precautions against scarring. Like I usually use estrogen, antibiotics. I might put a little balloon in to keep the walls apart. And I do tell the people with a very large septum, it can be like 2 steps forward, 1 step backward. So sometimes you need more than one procedure to completely correct the uterine cavity, but they are very minor procedures.
Got it.
We only have to take a day or so off the day after. So, and usually dramatically improves outcome and does have minimal risk. So that doing that procedure seems very reasonable before you get pregnant.
At what point when people are kind of struggling to conceive, is this in that checklist of things that you need to cross off of the list?
So I think in the beginning, we feel like everybody should have imaging of their uterus, their uterine cavity, and their tubes. That's pretty basic. Right. So I would say definitely that's a good one to
is the imaging done though at the OBGYN level the same type of imaging they would get when they're at a specialist like your office?
Not a lot of OBGYNs don't necessarily do the full ultrasound screening in the office or saline sonogram. Some of them do. Everybody's different. It's extremely variable. It's not standard.
Okay.
Most OBGYNs will be able to do an HSG and, and be able to refer you to a reproductive specialist if you need one. But if you have any questions or any concerns or surgery is recommended, anytime for surgery, always a good idea, if it's not an emergency, to consider a second opinion.
Absolutely. Absolutely. Is this something that we've seen is historically covered by insurance as well?
Yes.
Because it is a genetic condition.
Usually always covered by
Okay.
basic commercial insurance. Yeah.
Okay, got it. Because it is, whether it's genetic or just an abnormality, you know, from your growth and development
Right.
in fetal development, it would be covered. Okay, got it. This has been incredibly helpful. So, I mean, a couple of the key takeaways as I'm thinking through this is if someone gets a scan done and it says bicornuated or bicornuate uterus, they need to ask the follow-up question is, how can I be certain it's not a septate uterus?
Right.
And so that's, and the differentiation between the two is whether the outside of the uterus is also heart-shaped.
Right.
Or if it's flat, and that is the distinction. And we'll make sure we include all these pictures and images and links to everything that everybody needs. And what they should be at a minimum asking for with imaging to be certain is at least a saline ultrasound, correct?
Yes. And sometimes it's a little tricky to tell. Sometimes you need to go to pelvic MRI. Like some of these people, I'm doing an HSG, then a saline sonogram, then a pelvic MRI. Sometimes you even need to do the hysteroscopy and the laparoscopy at the same time so you can really see everything. That's how we used to do everything in the old days, but now usually you can know what's going on with a really good saline sonogram.
Okay, got it. I have one final question, I think, because this has been so eye-opening. Does weight impact the quality of the imaging?
It can, yeah.
Okay,
So
and
if somebody's tricky to see, then we might want to go to MRI or something like that. Although the weight usually impacts imaging of the ovaries much more than the uterus.
got it. Okay, that was so incredibly helpful. I hope everybody else found it helpful too. I just learned a couple of things brand new, and very happy for that conversation. I'm Alice. Yes.
One thing to remember, you should have a kidney ultrasound. If you have a Müllerian anomaly, any kind of Müllerian anomaly, get a kidney ultrasound because the kidneys and the uterus are formed at the same time. So your risk of having like a pelvic kidney or a single kidney or some kind of birth defect like that might not cause any symptoms or any issues is a little bit higher than average when you have these uterine abnormalities.
Got it. Okay, that was something else I did not know. So the kidneys and the uterus are formed at the exact same time. What stage of pregnancy is that formed?
Oh God, I don't even remember. I think it's around 15 weeks or so, but I can't remember.
Very early. Okay,
yeah,
very early.
It's very early.
Yeah. It's so incredible, the human body. Always fascinating to talk to you, Dr. Chen, my good friend Serena. I'm Alice Crisci, your co-host, co-founder and creator of the Fertility Answers app platform. If you have follow-on questions for Dr. Chen, please join her on the platform. And as always, leave your comments below, subscribe, like, share if you found this content to be helpful. And we'll hopefully see you next time. Thanks so much.
Bye. Have a great
Bye.
day. Stay safe.